We established the Atlanta Long COVID Collaborative largely based on the response that we were hearing from our patients and what we were seeing across healthcare systems. We found that many clinicians didn't feel comfortable providing care for these patients, understanding the management. And so what would happen is patients would then be referred to multiple subspecialists and have extensive workups that were oftentimes cost prohibitive for the patient. The results of these tests oftentimes were normal, and so then the patient were left without answers and without treatment. In a worst case scenario, we would actually see that some clinicians were unfamiliar with long COVID or may not have even believed in long COVID. And so that would result in patients having their symptoms dismissed, which could be really frustrating for the patients because for some patients, they can be really disabled from long COVID. In fact, up to 25% of patients have significant impact on their quality of life and function, and many can't return to work. And this inspired us to develop long COVID clinics at Emory University and Grady Healthcare in late 2020. And since then, we have been funded through the Agency of Healthcare Research and Quality, which has allowed us to expand to a long COVID center of excellence, where we aim to provide multidisciplinary care that's comprehensive through a patient-centered care model.
Long COVID patients come with a whole array of symptoms that are associated with their syndrome, such as shortness of breath, chronic pain, dysautonomia, and fatigue. To help manage that multiple symptom approach requires multiple specialists, tailoring a personalized care for each patient. With this collaborative and the multidisciplinary approach that we have to the patients, it is crucial to understand that the primary care doctor tends to be the first physicians who hear about the long COVID symptoms, who are keyed in being in position to recognize long COVID. So for us, when patients are seen through their primary care doctor and then referred to us, we work to establish a plan of care for these patients and then communicate back to the primary care team about what we think is happening, what plans of approach may be effective for these folks.
Patients come to us because no one is really listening to their needs. So when they come to us, they're relieved that we understand what their symptoms are. We are trying to address their needs and their care. What a physician puts in a referral, we expedite the appointment, and patients are seen through with getting to other providers.
We've noticed there's a significant lack of knowledge and or awareness of resources in the area. We've collaborated with healthcare providers and organizations to better educate and enhance education surrounding long COVID. We've also done various outreach events at local churches and community organizations to better target our population. The Atlanta Long COVID Collaboration incorporates patient feedback to ensure that we meet the needs of the communities by establishing a patient advisory committee. Our patient advisory committee is comprised of patients that we see in the clinic, as well as national long COVID representatives. They give us ongoing feedback as far as the workflows and functions, as well as how to best meet the needs of our patients seen in clinic.
Being able to give them my feedback or give them our feedback of will this help us, what challenges we're facing so that they can put those accommodations in place are very helpful. And a lot of people don't realize when it says inability to walk, we can walk one day, we can't walk the next. Like even now I'm talking, I'm out of breath. I've had to fight just to get myself to this point. And Dr. Walker is literally my angel. Dr. Hahn, the entire team are my angel. I felt very alone through this journey. I've had a lot of medical gaslighting from healthcare professionals. Here, when they listen, it makes me want to continue to fight for myself and others. Because when you're fighting for something that's so new and you feel so alone, you fall into a very dark space of depression. But when you have a team of people, it gives you that fresh motivation to keep fighting for and advocating for it.
The Atlanta Long COVID Collaborative could not exist without the support of AHRQ, the Agency for Healthcare Research and Quality, who have funded 12 long COVID centers of excellence across the United States, for which we are one. We collaborate with the other AHRQ-funded long COVID centers of excellence through the learning community, where we discuss best practices for case management, patient care, care coordination, and other topics that are key to advancing long COVID care.
The goals and objectives for the next few years are to have a staggered approach. So our step one is to educate the community and patients about long COVID, to really reach out to the community through our community outreach programs. The second stage approach is to then educate our peers, our healthcare providers and clinicians, so they are aware of long COVID. So when a patient comes to see them, they can refer to a long COVID center of excellence in order for referral support and additional care. But also we want to educate them so they know how to diagnose and treat. And we plan to do that through our educational lunch and learns or road shows, where this could be virtual or in person, where we're going to different clinics in the area and the community to educate healthcare providers. And then lastly, our goals for the next upcoming years is to continue our collaboration with the other sites in the Agency of Healthcare Research and Quality Collaborative. Think about best treatment practices and how best to serve the patient.